Welcome to today's episode of the Back in Shape podcast. Today we're going to be talking about chronic back pain. We're going to go through what it is, how it comes about, importantly, because we have to recognize where it's come from. Otherwise, we're just not going to get any results. And that's perhaps one of the reasons why people do get stuck into that rut. Then we're going to talk a little bit about the lifestyle implications that lead to the perpetuation of back pain to the point where it becomes chronic and maybe even lasting over many, many years. And then we're going to talk about some of the mental health components and finally round it off with what we can do from an activity point of view moving forwards. And hopefully this is going to be a really insightful episode for you guys. And as always, there's a comment section, whatever platform you're watching this on, if it's YouTube or on the website, you can use that comment section down there to ask any questions that come up along the way. So that would be helpful, and I've got some notes up on the board to make sure that we are covering all the main points today. But I thought it'd be helpful to start out with what chronic back pain specifically is, and that is back pain that lasts for longer than 12 weeks. Not necessarily continuously that entire time. Many people will have a daily pattern or daily picture where it flares up during certain times of the day, etc. But it's kind of a consistent feature of your life to the point where it's affecting your life on a daily basis for that 12-week period. Once we move beyond that, it starts to be considered what is called chronic back pain. And there are all sorts of reasons why this seems to be enabled especially here in the UK, because of the way in which back pain is invariably dealt with. It's often more than 12 weeks before you even get seen to. So your back pain by definition will have often moved to the point where it is chronic, unfortunately. But that's a whole nother podcast. The important thing here, though, is that it's lasting beyond the point at which healing should take place. And I want to make a very clear distinction here, because you'll see online it's after healing has taken place. And I would put to you that actually there are many factors, some of which we'll explore today, why proper healing hasn't taken place and why we've essentially kind of blocked that process from taking place. And that's perhaps why these symptoms linger, why we have such vulnerability, why we just can't get past that back pain in any meaningful way, and why it fundamentally is a chronic picture in our daily lives. So hopefully this will get you guys thinking about perhaps why yours is chronic the way it is, and how to move forwards as well, because there are plenty of things we can do to move forwards and actually be rid of it if only we become aware of the areas that are holding us back. And fundamentally, the main reason why chronic back pain occurs, chronic back pain persists, is because we have stopped the healing process. Back pain invariably is a you problem, unfortunately. It's a problem of our own making. We haven't had the factors in place to allow us to heal effectively from this insult, and we have invariably been hampering or hamstringing ourselves as our body has been trying to heal, because every single one of us, our body's always trying to heal. But in the cases of these chronic conditions, specifically with back pain, we are getting in the way of the healing process. And I will talk about that now. The first thing to help you understand this is thinking about a scab. Even when we were children, we can all recognize this. Parents being told, don't pick that scab. Ill scar. What is a scar? We can all see it clearly on the surface of our skin. It's where the skin tissue does not heal properly because we're constantly disrupting that healing process by picking it. What are we left with? We're left with scar tissue. Tissue that is not quite of the same quality that the original tissue was. Tissue that has a boundary around which it attaches to normal tissue, an area where maybe things are a little bit weaker than they otherwise would be if the tissue reorganized itself in a smooth, continuous way, like many other injuries that we've had, again, just referring to surface wounds, where they do heal up and you don't know anything's there. Because we've constantly been picking that scab, interfering with that healing process, it comes up with scar tissue on the surface and we can see the consequences. Well, the same thing I would argue is happening in your lower back when we are getting to the point where we have chronic back pain. We are constantly picking that scab, aggravating those things. And there are a few areas where this has happened. I'm going to go through 4 of them now with you guys that allow this scab to constantly be picked. And then there are going to be others that will come up. And if you've got any questions, perhaps you can post those in the comments below and we can review some of those specifically. But first and foremost, we don't have many people in the UK, and I would argue in other areas. I know many of our audience are in the US as well. In both places, as well as maybe where you are if you're somewhere else, we are not healthy. We are not fit. We are not strong. We do not have appropriate muscle strength and flexibility on a daily basis. And this is borne out in the woefully inadequate state of affairs with regards to our NHS waiting times, with regards to obesity data, etc. We are not healthy people. And that means that doesn't happen overnight. That happens with years of not looking after ourselves. So we don't have the muscular support and the flexibility. And this will come in later on, because those factors mean that when we have that injury, we can't necessarily protect it. The back is not like the ankle or the wrist, etc., where we can put something on there to hold it steady and allow it to go through a less interrupted or allow through a more controlled healing process. The back, we cannot do that. And therefore, our conditioning is really quite pivotal. If our system is not healthy and well and strong, then healing evidently is probably not going to take place at the same sort of rates. The next thing is the way in which we're moving on a daily basis. Really a function of the former, but we move in ways that are improper. We get up and down out of chairs, etc., in ways that don't help us, in ways that put more strain on our lower back. We have postural habits that put more strain on our lower back, and we did a whole episode on posture, so I won't get into the details here, but fundamentally, bad postures will exert more strain on our back, and if we have an injury there, it's going to be consistently exerting more strain, more stress on the tissues that are trying to heal. For example, we've all had stubborn blisters on our heels. Why is it a problem? Because when the blister is trying to heal, we have more strain, i.e. the shoe rubbing on that blister, which helps interfere with the healing process. So there's two. The third thing is the daily habits and practices. These are the ones that really kind of blindside us. We don't have a clue. The way in which we spend, on average for adults, this is from a recent research that we did from the British Heart Foundation, 9.5 hours a day sitting. Sitting, loading more through the lower lumbar discs, and most of the injuries that we have in the lower back are in that lower lumbar section, L4-5 and L5-S1. Pick your diagnosis and insert it here at that level. But the daily habits of sitting for extended periods puts a tremendous amount of pressure on that lower area, and it's over such a long period of time. Other things, the way in which we do things on a daily basis, serve to continually aggravate that lower back and make things worse. And then finally, we have, unfortunately, a misguided understanding of what it is to injure the lower back, which structures are injured. So many times focusing in on the muscle tightness or stiffness that one will of course experience with any injury to the lower back and trying to stretch those things out. But those common exercises that more or less everyone with back pain will gravitate to first, the knee hug, the child's pose, rounding the back more, only serve to reinforce the fundamentals of the very injury that kicked this all off. And therefore those early interventions of stretching it out as the scab in your lower back, and just for very simplistic purposes, as the scar tissue is trying to heal and knit back together again, you're doing knee hugs that are pulling it all apart again every single day. And we discussed the importance of this in our episode on the lordosis and in other episodes on flattening the lower back, and how this influences that desire for your body to try and move back to a healing process. If we talk about a knee or an elbow, well, perhaps the knee is a better option. Many people will relate to a strained medial collateral ligament, and that is where the knee joint buckles to the inside and strains the ligament. Well, you wouldn't dream of regularly doing that movement immediately after the injury has taken place. You wouldn't continually buckle the knee towards the inside as part of your therapeutic approach. Yes, you would do things to the knee from a movement point of view, but you would not repeat the very action to strain the very tissues that are trying to heal up. It's just madness. Yet we routinely prescribe those sorts of things when it comes to healing the lower back. And there is talk about flexion, but we'll touch on that on another episode, and we have done in many other podcasts. So that's something to think about. Those silly exercises that are included by fundamentally individuals that just don't fully understand what it is to really injure the back. It's not muscles, it's the spine. And if we understood that better, we wouldn't be prescribing those sorts of exercises in the early instance, because they, again, contribute to that back pain not resolving and becoming chronic and interfering with the healing process that's trying to take place, restoring stability in our lower back. Now, if we use that to transition straight into the lifestyle side of things, this is really important. Hopefully, me covering this area will start to give you guys a few ideas in ways in which you can change things. Lifestyle is the area that people just ignore. They go online and they look for exercises on YouTube to fix the lower back pain, but they completely ignore the fact that our lifestyle dictates how we spend more or less 24 hours of the day. It's the way we're doing things. And I mentioned earlier on about the sitting, the long periods of sitting every single day that we do. Simple changes here, like getting a sit desk, a sit-stand desk preferably, moving around more in the office, taking phone calls and having a walk around the office, having a big bottle of water on the side that you can go and fill up regularly, breaking up your day so you're not sitting for such prolonged periods of time. Having a think about how we use our body. It's great that you may be someone that has a desk job and you want to do something to keep active and work on your cardiovascular system. But if that choice is cycling or rowing, that's just not helpful, because you spend all your hours sat down and then you decide to do a cardio mechanism that is sitting down as well, further adding to that strain on the lower back. We have to think about these things a little bit more, and some more. If we are trying to do maybe some cardiovascular exercise, which is important for all of us, if we're someone that's sat down all day, maybe choose a cardio component that is not going to be sat down also. Little things like that make a big difference. But sitting is such a pervasive activity into our daily lives. And if you're someone with chronic back pain, it's probably been a habit for a long period of time and you just don't think about it. And unfortunately, with sitting specifically, there are some nuances where sitting actually feels relieving for people with back pain or sciatica, and that can be a problem. And it's basically because the little holes where the nerves come out of get larger when we sit down because of the mechanics of sitting. That's a problem, because as that happens, we squash down on the disc more and stretch the structures that are trying to heal back together again, and it's a bit of a vicious cycle. So unfortunately, that gets you caught out, and we've got a video on that specific phenomenon and why then when you go from sitting to standing it hurts, and why that's actually happening. And I won't get into that here because the podcast will probably be about 3 hours long if we end up going down every rabbit hole. But suffice to say that even sometimes when you have back pain, sitting can feel nice. It's not helpful for your back pain, and it's making things worse fundamentally. And if you've got any questions on that, post those in the comments below. The next one that people just don't think about is that slight forward bending. Now, this isn't a problem when we have a healthy back, but when we don't, when we have that injury, this slight forward bending, like when we're doing the washing up, when we're doing the vegetables, when we're cooking over the stove, other activities, even, for example, brushing the teeth, when we're leaning slightly forwards, less so with the brushing teeth example, for extended periods of time, we have our whole body weight on that disc. Probably we're doing it with a rounded lower back, so we're even more so shifting the biomechanics onto the disc and stretching the ligaments on the back. But we're doing that for long periods. Maybe it's 15, 20 minutes peeling the potatoes and cooking, etc. Maybe longer than that, depending on if we're doing a roast dinner. And we don't think of this. And then this kind of feeds into the mental health component that, why does my back keep flaring up? And we'll get onto that a little bit later. But there's another example for you. So if you're, say, for example, preparing dinner, preparing lunch, maybe do some of it, and this is going to sound a little bit contradictory to the previous part, but actually maybe go and sit down to chop the vegetables and then get back up, because short bursts of sitting aren't problematic. It's the sustained over the whole day. But actually you'll find that changing your position and maybe doing some of the vegetables or some of the preparation, sat down for a few moments and then getting up and standing over by the stove and then coming back down to do something else in a different position can really help just alleviate the repetitive and consistent strain on your body. Alternatively, we can always get something or a platform to raise the height of our desks, particularly if you're a taller person, to raise the height of the work surfaces so you can do it in a more upright position and aren't having to round over quite so much and increase that load. As I said, it's a small increase in load, but it's done over 10, 15, 20 minutes. It starts to add up, and washing up in the sink is a no-brainer. We've had some make the very good suggestion in the membership of actually turning a washing bowl upside down and putting another one on top to raise the level of the washing that you're doing so that you can be more upright whilst doing it. So perhaps there's a little tip for you. The final one is bending down. Going down to tie your shoelaces, to load the dishwasher, to load the washing machine, to do anything on the floor, collect something off the floor. We often bend down just habitually with our lower back just rounding. And if we were to do the better approach of taking a knee, we don't have the strength in our legs to do it without our knees wobbling all over the place, and we end up rounding our back because we don't have a good hip hinge. These factors feed into everything you do on a daily basis. They are little opportunities to aggravate a weakened area of the lower back that has been injured and prevent it from getting better. And therefore, we have these little activities that we're just not aware of, and they constantly blindside us. They constantly catch us out, and we're left in that position where mentally we're like, man, my back pain just goes off all the time. I have no reason for it. I have no understanding of why it's happening. And like there must be something wrong with me because nothing seems to be working. It's always flaring up. And we don't have an honest evaluation of the way in which these lifestyle factors will have, in most cases, been there long before our lower back injury, or the main injury that kicked off the chronic back pain. And they are there maintaining it. And unless we look at those activities, we will never really have the opportunity for long-term consistent healing, because every single day we're affecting our body in a negative way. This is why in the program we have a huge component of education. And unfortunately, many people, not many people, but more people than I would like, skip that out and jump straight to the exercises. But changing and influencing with your lifestyle factors are such areas for easy, low-hanging fruit to be changed. Yes, it takes time to change those habits, but it can really start to accumulate if you just stop making things worse. For example, the person that's constantly spending more money, getting into debt and debt and debt, it didn't start when they were in debt. It started when they had money, and they've just gradually had bad practices that have just wound it down. But if they're trying to fix their circumstances and get out of that financial situation, they have to stop spending. They have to stop throwing money out the door mindlessly in order to actually get back to a position where they're in the positive. And it's the same thing with our back. We can do good things, but if we're constantly still doing silly things on a daily basis that we're not aware of, then that's a problem. Now that takes time. It takes time and an engagement in the process, but you can do that. And that's one of the things that we want to really tease out of this, is that chronic back pain often is because the person feels like they can't do anything about it. And this brings us into the mental health component. The man who thinks he can and the man who thinks he cannot often are both right. How you look at these things has a huge influence. And we've seen this over the years with members and with patients, people that have objectively really rubbish hand has been dealt to them. Yeah, they've got back pain, but they've got this and they've got that, and they've got all these other reasons, real reasons. Unfortunately, it's quite upsetting sometimes to see the challenges that some people have to face, not only with their back pain, but other things that just get in the way. They may make progress because they've got a positive attitude and they've got all these things going against them, but they still maintain often a really positive outlook. And they, in spite of those things, it's harder than it needs to be, but they still make steady progress, and they have setbacks, but they consistently push on. And then unfortunately, we see other people who don't have those same set of circumstances. They have bad back pain, yes. They have maybe an injury, yes. But when you look at the whole context, if you could lay out their lives together and let them talk to one another, the one person will go, gosh, I've got it easy. What the hell's my excuse? Why do I have such a negative outlook? There's so many people that have so many things going against me, and they're able to remain positive. And I've got this mental block that's stopping me moving forwards, when actually I've got so much more going for me to recover from this issue. And obviously we can't necessarily put those people together because it just doesn't work, obviously, with what we're doing. But it does really, for us, because we have that intimate understanding of many of our members and our patients over the years, cases, it is just something that occasionally you just look back on and think, man, if only so-and-so could talk to so-and-so, they'd have a whole new perspective and they really would be able to move forwards and actually change from a person who thinks they can't to a person who thinks they can. And that's really, really important. Now, moving on from that, or related to that, we have the effect of placebo and nocebo, and positive self-talk and negative self-talk, and the belief that something will happen, the sugar pill, if you will, but equally the contrary. And there is a growing body of evidence, and many practitioners online talking about this nocebo effect. The people that subscribe or get caught out by the nocebo effect, basically there's a negative. So in the case of the placebo, it's you take a sugar pill thinking that it's actually the medication and you get better anyway, and well, that's really cool because the mind is so powerful. Well, the opposite occurs. You think you're taking the poison pill, but you're not, and you then become unwell as a result. And that same thing can occur in the case of these physical ailments. And that is so powerful. And I would urge you, if you're someone who maybe is thinking about this, go and have a look down at some of the nocebo and placebo research to start to appreciate just how powerful your mind is. And that's why that quote is so meaningful. The man who thinks he can and the man who thinks he can't are usually right, because of the powerful of our minds. And if we can just shift our mindset, and hopefully this podcast is making you, if you're someone who's maybe errs towards the side of the negativity and feeling a little bit, oh man, there's no hope, we've already covered in the lifestyle some areas that actually you can really influence and start to look at. And then you're going to start to feel like you have more control. And then you're going to start to feel, okay, maybe things are possible. And then you're going to move into that positive mindset, not placebo, but that positive mindset to start to move towards getting better. That's really important. And the final thing, just on the mental health component, is the presence of stress. Now, back pain itself can be stressful. of course, but other stresses, outside stresses. We have to understand that the role of stress in our lives elicits a biochemical change, and those changes are designed to deal with fight or flight, to run away from something or to fight something. And that diverts blood to certain areas, it elevates cortisol, etc., etc., etc. And that has an understandable negative impact on your healing. If you're in the midst of having to engage in fight or engage in a flight or run away from a scenario, you don't need to be wasting resources on healing. Your body is set up to not heal in that time frame. Now imagine if you're responding in that state, that biochemical state, all the time, because we're not able to deal with the stresses around us in an appropriate manner, because we're maybe looking at things through a negative light. Our stress levels are constantly elevated. We're going to affect our healing in that manner. And that might feel overwhelming, and it's easy for me to just say, don't be stressed. And that's not particularly helpful. But starting to have some tools that we can rely on can slowly lower our stress. Doing other sorts of things like mindfulness and meditation can also help with our stress. Handling some of the sources of stresses can help. And there are plenty of resources online. We aren't experts in stress per se, but there are plenty of people who are, that can help you manage those stress levels so they start to come down and your body is able to then go, I can start working on providing resources to heal. It's many things added together. It's the lifestyle changes. It's handling the stress. It's having a positive outlook. And then it's what we'll get onto now, the activity side of things, that really allows us to move past this, because chronic back pain is such a multifaceted approach or multifaceted issue that we have to often get all of those ducks in order to make that significant progress. So then that brings us to the activity side of things. And having a plan to rebuild is so powerful. A lot of times people, they have a back injury and they go and see someone and say, just do this thing. And you're like, well, is that really going to help me? There's no real plan. There's no real structure. It's just do this exercise for how long? Till kingdom come? How long am I doing this knee hug exercise for? There's no plan there. So if you feel like you haven't got a plan, you don't have a lot of faith in what's going to happen. And then you can start to go, oh, well, that's what the expert told me to do. That's a pretty rubbish plan. And you can see how it's so easy to just get into that negative side of things. But if you have a plan, we find that many members, when we've, for example, in clinic, when we've gone through, or more recently on the virtuals, when we've gone through someone's imaging to help them understand exactly what's going on and how that fits into the plan. When they feel like they've got a tangible plan, it may not glean results overnight, but they've got a plan to go forwards to rebuild things. It can really, really make a difference. And that plan needs to include an adequate time horizon, because the time horizon has to be there. Too many people have this expectation. Unfortunately, we see it that, oh, I've just got a back injury and it should go away. But actually, there are all these factors that are stopping it healing and all these other things that have happened in the past. And actually, you need to have an adequate time horizon on how long it's going to take place. We did a whole podcast, how long it's going to take place. We did a whole podcast on the role of exercises. Too many people don't understand how exercises specifically work. Doing your relief-based exercises are relieving the strain on your back. And sometimes that doesn't glean immediate relief like taking a painkiller does. We're used to a society where we get things now. We have our smartphone now. We have our mail comes now. All of those other sorts of things on Amazon, it comes now. And that's not how our body works. It doesn't work in now. It works in a time horizon. So, and then understanding, for example, you move on and you start doing some strengthening exercises. That doesn't have results now. You need to do that consistently over a period of time, over weeks and months, in order for your body to decide that it's appropriate to transform, to change. But coming back to the short term, we do want those exercises and those activities and those practices and those lifestyle changes that we can do right now to alleviate the strain on our lower back. And that is part of the plan. And then we have to have that long-term plan. And that is, for example, what we talk about going through the phase 2 and 3 and 4 exercises and making sure that you know that actually you can't stop doing your squats with a 6-kilo kettlebell. You can't stop doing your hip hinges with a 5-kilo dumbbell. That's not enough. That's not appropriate levels of strength for you as a human being. Basically, from any age, from 16 or whatever age it is, all the way through to your 80s and 90s, that kind of weight is just not sufficient if you're going to be having to move a plant pot that weighs 15 kilos in the garden, or if you have to move a wardrobe that's going to weigh a reasonable amount of weight, or lift some furniture, or carry your 25-kilo suitcase. You have to have that time frame and that long-term horizon to build strength over the long term. So that can influence your movement patterns, that can influence your daily habits, that can influence how you go down onto the floor and how you come back up again, how you load the dishwasher, etc. That strength can allow your body to move more effectively and protect your lower back pain or your lower back injury. And not only that, but the strengthening process, when we use resistance, not when we do other exercises like Pilates or yoga, which has no resistance going through it, but when we put load on the spine at the right time, of course, not at the wrong time, and we grade it slowly. That contributes to the strengthening of those lower back structures, the ligaments, the discs, etc., the muscles in that area, so they are able to bear load more effectively. They are more used to it. Fundamentally, the activity component of this, we've touched on lifestyle, we've touched on the mental health, but the activity component is about transforming your body. And as we mentioned at the outset, and quite a nice place to finish, too many of us have not looked after our body over the years. We are not physically conditioned well. We do not have good movement patterns. We are not able to do simple squats to reasonable depths. We are not able to lift reasonable amounts of weight for our own personal goals. I'm not saying everyone has to be an Olympic lifter, but we have to be able to lift a reasonable amount of weight competently without our knees falling all over the shop, our back rounding and us falling over. And unfortunately, that's the state of affairs for many people who do not partake in regular exercise to keep their body healthy and strong. And if we've got an injury down there, we need to overcompensate in these scenarios, but we have the ability to transform our body, and that has so many positive effects elsewhere, not only for the back, but for the knees, for the ankles, for the hips, for our cardiovascular health, for our whole body, for our mortality profile, the risk of death at any age. It adds years onto our life expectancy by just getting healthier overall, and doing that process of improving your levels of activity, partaking in that element of resistance training to rebuild and strengthen our back will have so many wide-reaching benefits on various areas and systems of our body. It is not worth not doing, if that makes sense. It's something that you should all work and strive to do for the long term. And we have many people that they have had chronic back pain for many years. They come into the program and they actually transform everything. They start incorporating exercise for the long term. They're doing this element of resistance training. Maybe they were doing some other activities before, some element of light cardio, but actually resistance training has become a major factor in their daily life. And that is not a terribly time-consuming factor, but that allows you to enjoy life and protect your back from this constant torrent of abuse that life sometimes throws at it. We have to do things on a daily basis that aren't necessarily ideal for our back, but if our body is strong, we're able to do those things without getting injuries and without having problems. So a nice place to leave it. Hopefully today's episode has been helpful and has been insightful, and there's a couple of things for you to think about. Particularly, I would encourage to think about that mental health component. Think about the lifestyle things that you can really have control over and change, and accept the fact that, and don't get stressed out about the fact that you're not going to change all of them at once. But through learning and through thinking about your body and becoming more aware, you will be able to steadily knock off some of those lifestyle factors that are problematic, modify them, change them, so that they can work for you rather than against you, and hopefully get your back into a position where, alongside the right sort of resistance work, you can start to really rebuild things, take control of the situation, and move forward and move on with your life and do all the things you want to do without having back pain and chronic back pain looming over your shoulder. So thanks for joining us on today's episode. If you did find it helpful, consider giving it a thumbs up. If you know someone else who's really been struggling for a long period of time, maybe they've tried some of those other silly exercises and it hasn't worked for them, and they're still just going through it, back pain's always a feature for them, then consider sharing the podcast with them. Hopefully it helps them too. And as always, have a great day, and we will see you next week on the Back in Shape podcast. Thanks for watching.